Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. GLP-1 drugs such as Ozempic Zepbound help protect against sleep apnea, study says. Breaker number 148, weight loss drugs like Ozempic and Zepbound might help protect people from health risks related to sleep apnea, a new study says. Break type 2 diabetes patients taking GLP-1 drugs were overall less likely to die within the next year, but those with sleep apnea did even better, researchers reported Monday at a meeting of the American College of Chest Physicians in Chicago. Break and number 156, we observed 1-year mortality in patients with type 2 diabetes who were prescribed GLP-1 RAS to be substantially lower than patients not prescribed GLP-1 RAS, with a disproportionate benefit observed in those also diagnosed with obstructive sleep apnea, and number 157, lead researcher Dr. Cosmo Fowler, a sleep medicine physician at Piedmont Health System in Atlanta, said in a news release. The results support the U.S. Food and Drug Administration's, FDA, decision in December 2024 to approve Zepbound, tirzepatide, as the first drug to treat sleep apnea in adults with obesity. Sleep apnea occurs when a person's upper airway becomes blocked while they snooze, causing pauses in their breathing that awaken them. The result, poor sleep night after night. Sleep apnea is more common in people with overweight or obesity, because excess weight from fatty deposits increases pressure on the upper airways, causing them to collapse, according to the Obesity Medicine Association. Extra pounds also reduce a person's lung capacity. For the new study, researchers analyzed data on nearly 1.8 million patients with type 2 diabetes, of whom about 28% had been prescribed a GLP-1 drug. Glucagon-like peptide 1, GLP-1, drugs mimic the GLP-1 hormone, which helps control insulin and blood sugar levels, decreases appetite and slows digestion of food. The drugs initially were developed to treat diabetes, before their weight loss benefits were observed. Everyone taking a GLP-1 drug had a lower short-term risk of death, but those with sleep apnea had a 20% lower risk than those without the breathing d-speak disorder, results showed. The absolute risk of death among people without sleep apnea was 0.9% for those on a GLP-1 drug versus 1.8% for those not taking the meds. By comparison, the risk of death among sleep apnea patients was 1% for those on a GLP-1 versus 2.5% for those who weren't. And number 156, this large-scale analysis suggests that OSA status may act as an effect modifier in the association between GLP-1 RA prescription and mortality, and number 157, Fowler said. Based on these results, doctors should consider whether a person has sleep apnea when deciding whether to prescribe a GLP-1 drug, researchers said. However, they said more research is needed to better understand why GLP-1 drugs might help sleep apnea patients, and to track the potential longer-term benefits. Findings presented at medical meetings should be considered preliminary until published in a peer-reviewed journal. Sources: American College of Chest Physicians, news release, October 28, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next: one of the deadliest syndromes you've never heard about. And number 148, it's one of the deadliest syndromes you've never heard of, but experts are hoping to change that. Nearly 9 of 10 Americans have not. Diabetes drugs, Jardiance, and insulin nasal spray, might counter brain decline in early Alzheimer's patients. And number 148, 2 widely available diabetes medications appear to safely improve brain health among people with early brain decline. The diabetes drug. Break skinny fat contributes to heart attack, stroke risk. Break and number 148, hidden deposits of fat deep inside the abdomen and liver can quietly increase your risk of stroke and heart attack, even if you appear to have a. Break more news resources to MedWatch Drug Alerts Daily Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break /speak. Speak whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak.